Now, these are some of the bills that I have been paying, for years on this one. This was almost $7,000 when I started on it. I've been paying 100 a month on that one. This one here, I got it paid quite a bit. Only $30 on that bill. That was I've been paying that one for years too, and it shows the details on these, which is cool. Where I'm making these payments through. It says the agency payments. I call them, make the payments, 100 or 150. But that was like 7,000 down there. It just shows where I've been paying all this. But what I was looking at was back to these test results. I'm talking to people about reading it, and it talks about these exclamation. And I go in here and I look at it, and I was looking at what they had an exclamation point about, and I see that the glucose level is over you're normal if you're 70 to 99, the glucose level. So this would mean pre-diabetes right here, as well as this right here. See where I'm over the limits on these. So I'll go back down, and that's what it's showing there is pre-diabetes, and we're going to try and find it. The complete blood count, is that where I was at? It shows white blood cells, red blood cells, all this being quite normal until you get down to the platelets. Way up there, way up here. All right, this right here was what was showing them that it might have been a UTI, but there's not as bad as it was before. But I'm looking at these where it's high. I'm gonna look these up and see what they mean with the platelet count. Seems to be a little bit high. Okay. See, some of this, when they got these on there, it's telling the doctors. I'm going to find it. Your analysis. When they did that, I had been drinking a lot of lemon water and stuff like that. Large amounts of red. Yeah, but they're showing it clear. So I'm just going back through here. I want to find where I saw that earlier. Let's see, is it this one? Now the glucose on it was negative here. It was high on the other one. I'm trying to look and see where I saw that. Let's go back down here. This is what I'm doing with here. I know I saw it on here where it said it was pre-diabetes. I want to look. If I have to look at all of them, I will. I'll go back over this one again. Because of this glucose. One more time. I know I saw it. Nope. Third one. I'm just looking because I know I saw it where no, this is 2013. This that I just saw was different. I know that it was there. Well, I know that they're looking at me for pre-diabetes. I have to find out where it is in here so I can show that. I have all this health stuff going on while still trying to maintain working. And when you're in pain, you know that it's cutting your hours. I did apply with medical for medical through the state, but they said I made too much. Uh, I guess 40,000, and then her little bit of Social Security. They say that I make too much for that, but I don't know if that's correct. Because basically, what I've been doing is, I've been working through this pain because I have no choice. I missed a week of work last week, and if I have to sit down or something like that, it causes a problem on the job if I have to relax. They don't care, about somebody being older and having these pains, so they cut my hours. I've had problems with this stuff for the longest time, so I'm thinking about just removing myself from the workforce and getting this stuff dealt with, the back and the diabetes and the kidney cyst and this kidney stone. Think about removing myself from work to just get this done. I'm pretty sure that we could make the basics. But once I get this stuff done, I do believe with this right here, as I could show that this bulge has been increasing over the last 10 years with this lateral recess, with it being severe. There is pain there, but I have to ignore it, and that would limit me, as to what I used to be able to do before this started. So I think I might, just by going in straight up and talking to Social Security, maybe we'll be able to get some SSI or some SSD on this until I can get this. If I can get this stuff straightened up, I'd rather be working, but I think that I need to get these things done. Yeah, I know I saw the pre-diabetes somewhere on this as well. But this is gonna hurt. I'm just waiting on it to drop. And then it's got two more behind it. Uh, it's gonna damage my kidney if I don't get this thing out of here. Well, that's just where I'm at. I'm just venting. So I know I saw it say pre-diabetes. So anyway, that's where I'm at, people.